Hi, I'm Dr. Suruchi Garg. I'm going to talk about the acne in age group of 30 to 40 years of age amongst women, and what are the causes, and what is the best management we can take up, and what is the treatment option here. So this is a very interesting age group from a dermatologist perspective, because here acne is just not on the surface, but there's a deep underlying smoldering disease which we need to diagnose along with the acne and treat it side by side. Now, what are the various causes for acne in this age group? Well, first is the diet and the lifestyle and excessive stress, because you are sandwiched between different generations, your children and your grandparents, or you pursuing your career. So there's a lot of stress which is mounting up, and stress usually leads to the stress eating, which could be very faulty, which could be high glycemic index food, which could be excessive sugars, refined carbs, your excessive dairy products, or your junk food, or even whey protein for that matter. And then the stress can also lead to lack of sleep and lack of following a proper circadian rhythm. So these are the major reasons, but then besides these, we have to find out the underlying hormonal imbalance, especially if your acne is coming along the jawline. This could be a major actually presentation of underlying hormonal imbalance, and this has to be tackled by the adequate blood tests, the panel of tests which is recommended, and by the clinical examination of the patients. Now, besides this, of course, we have various other dermatological conditions which can coexist, which includes rosacea, seborrhea capitis, excessive oil production due to different reasons. It could be also because of various medication that you're already on, which could be the corticosteroids. It could be the antidepressant therapies. It could be drugs like lithium or anticonvulsants, which actually lead to a lot of acne production. So we always have to find out those underlying causes of drug-induced acne in your age group. The metabolic syndrome includes the diabetes, hypertension, and heart diseases incoming, and also dyslipidemias. And again, the major cause is high carb, low protein diet in this age group, which eventually leads to these lifestyle problems. And the acne could be just a presenting complaint in these patients. So a complete evaluation, and of course the blood tests are always needed. Now, one very important contributory factor here is the use of cosmeceuticals. Now, because you have acne, you want to conceal the pigmentation following acne or the active acne. So many a times you're layering a lot of cosmeceutical products, which are again clogging your pores and aggravating the acne. So this could again be a major cause of a vicious cycle which has set in because of the acne. Your makeup regime should be very clean, and please try to avoid makeup on routine days. You can just use a very light moisturizer which is oil free, non-comedogenic, and which has you can always use a light tinted sunscreen instead of a foundation which is thick and clogging. So light tinted sunscreen is giving you dual benefit. It is concealing to some extent and also giving you the photo protection which can otherwise aggravate your acne. And also twice a day your cleansing regime should be very methodical. You should use the face washes which are specially recommended for acne prone skin, but at the same time don't dry down your skin, because excessive dryness can again trigger the oil production, and that can hamper the acne treatment again. Now, coming on to the management part. So the complete blood tests including vitamin D, B12, iron studies, ferritin, these are the usual panels, along with the hormonal profile in case there are some signs of hormonal acne. We always take care of these factors and evaluate the underlying disease cause. And then the treatment part comes. You might be offered antibiotics and the retinol based preparations. Now, I'm very fond of retinol with peptides and moisturizers in this age group, because while addressing the acne, we are also targeting the underlying aging part, the wrinkles and the fine lines which are appearing, that can be taken care with the very methodical retinol application, which could be on daily basis or which could be calibrated to alternate nights or based on your skin type, which has to be decided by the dermatologist. And the morning there can be other preparations which are glycolic acid based or salicylic acid or niacinamide. Again, has to be picked by your dermatologist based on your presentation, and it always has to be customized. It cannot be random pickup from many of social media posts. You have to get your treatment customized by a dermatologist. And then sun protection. Of course, it should be non-comedogenic, light sunscreen, which could be tinted or non-tinted, which is going to protect you from the harsh sun rays and prevent you from post-inflammatory hyperpigmentation. Now, once you have those stubborn acne, we can always complement the treatment with other modalities, which are ablative and non-ablative lasers. The non-ablative lasers and IPL technologies, they help you taking care of active acne. They kill the bacteria and they take care of the brown, red spots and the post-inflammatory hyperpigmentation. And in case you have the scarred lesions, you have atrophic scars, you have multiple scars which are, affecting your uh, confidence, which are affecting your psyche, they can be tackled with ablative lasers or microneedling radiofrequency procedures, which are very, very effective, and they can give you the improvement to the tune of 70 to 80%, maybe more than 90% in case you're compliant. And these can be combined with regenerative therapies like PRP therapy, GFC therapy, or exosomes, and they are very, very promising treatments. So always remember that your treatment has to be addressing the root cause. It should not just work on the surface, number one. Second, you have to follow and respect the circadian rhythm, which is very, very important. Please follow 8 o'clock, 2 o'clock, 8 o'clock dietary regimes. This works best for skin and hair patients. And early morning, high protein diet. I follow proteins at 8 a.m. early morning to start that healing process right in the morning, so that my body doesn't see excess sugars in the morning, but it sees more proteins, which start the healing process. And in addition, if you have acne in this age group, please visit a dermatologist who has to see the underlying cause. Acne is a systemic disease now, and it has to be treated on those terms. And we can actually prevent a lot of other diseases which are coming in future in case we tackle your acne the right way. Take care.